class session, we will explore the organizations, services, and people involved with the healthcare industry. This diagram shows the sectors of the healthcare industry that we will discuss throughout this class. Patients are at the center. We will refer often to policy in this class. You must begin to appreciate the influence of policy on the healthcare industry, and consequently, on the people working in it. Next, we will look at some of the organizations, services, and people within each sector. This diagram emphasizes the processes and functions within the healthcare industry and names the concepts slightly differently than the previous diagram. Let's look at this a bit. The payers, providers, and suppliers or producers all play a big role. They are regulated. There are regulators that determine how a payer pays for services. There are regulators that oversee how providers provide the services. And there are regulators that help to determine that there are safe and effective supplies for the producers. The end goal of all of this is that everyone is working together to serve the consumers or patients. Let's look a little bit closer at the 3 Ps, the producers, the payers, and the providers. We will talk a lot about the 3 Ps throughout this course. First, let's take a look at some of the examples of the organizations in each of these sectors. This is a busy slide, but it shows the big picture of what we are discussing today. Let's break it down by the categories. We just looked at some examples of various organizations in each sector. We can also look at some of the services and people working within each of the categories. Organizations can be further categorized in terms of their ownership. Let's think about hospitals for an example. All hospitals are either public or private. Most hospitals in the United States are private, nonprofit, community hospitals. According to the American Hospital Association, or the AHA, 5,000 of the 6,000 hospitals in the United States are community hospitals. About 3,000 of those are private, nonprofit community hospitals. Let's look at 3 local organizations. First, Hennepin Healthcare, a public nonprofit organization located in Minneapolis. This is in the provider sector of our 3 Ps. That's Medtronic, a private for-profit organization in the producer sector of our 3 Ps. Finally, Blue Cross Blue Shield, a private nonprofit organization in the payer sector. Integration can refer to vertical integration of different levels of service, for example, hospitals, health clinics, and other health facilities. Within sector integration can also include affiliations of hospitals and physicians, which is increasingly common in today's healthcare industry. Integration can mean working across sectors. This type of integration can mean that the insurance function and the healthcare provision are provided by the same organization. What about the services provided in the healthcare industry? Again, this list is not exhaustive. This slide presents some of the services that are provided in the 3 sectors. There is significant diversity within each sector. One way we can categorize services is clinical versus non-clinical. Clinical services are often the first thing we think of within healthcare, but the non-clinical services fuel all of the clinical work. Non-clinical services are essential within all 3 sectors. Clinical services can be provided within any of the 3 sectors. These can include direct care providers, laboratory and diagnostic services, implementation of care technologies, such as product representatives involved with an implementation of a device, case managers, clinical research personnel. You get the idea. So finally, we get to the people. These are some of the people who work within each of the sectors. In this course, you will have a chance to understand and explore various roles in these sectors. This list is not meant to be exhaustive, but it may give you some ideas of other careers that you may not have yet considered. Hospitals are the second largest business in the United States. They employ 40% of all healthcare personnel. Their collective payroll accounts for at least 1/3 of our nation's health expenditures. Approximately 60% of federal monies go to hospitals as reimbursement for patients who are enrolled in Medicare or Medicaid. We live in what is known as Medical Alley, with countless biomedical startups right here in the metro area. Also, right here in Minnesota, we have United Health Group, which is one of the largest insurance companies in the world.